Hello, this is Dr. Chris Marshall here at Medical Specialty Clinic, and today I wanted to touch on a topic of glutathione. Glutathione is an antioxidant, and some people would say it is the mother of all antioxidants, so it is very powerful. Patients ask me about ways to detox and take supplements that help decrease inflammation and live a healthier, longer life. So when they say that, I usually offer up a few things that can help, and glutathione is a good supplement to look into. So as always, this is not medical advice, this is just for informational purposes. Always, if you're looking at taking a supplement or changing your diet or anything like that, please discuss that with your individual healthcare provider before making any changes. So back to glutathione, strong antioxidant. The body makes that naturally. It's actually the combination of 3 amino acids, and it works throughout the body to help get rid of free radicals. And if you've read up on this at all, you know, free radicals are byproducts of chemical reactions that can damage cells in your body, and they actually can damage things like DNA and RNA over time, and can promote possibly cancer formation, things like that. So antioxidants help us get rid of oxidative stress in our bodies, and that's one of the reasons just being under a lot of stress mentally and socially can increase free radicals. So if you want to de-stress, that's always a good idea. While glutathione doesn't decrease your stress in your life, it can help get rid of those free radicals and other things as an antioxidant in the body. So another area of antioxidants that you probably have heard of, vitamin C and vitamin E, they work as antioxidants in the body as well, and they're good, and they can go well with glutathione, but glutathione is actually more potent and supported by vitamin E and vitamin C. If you take glutathione, you want to make sure that you get liposomal glutathione. So liposomes are a lipid layer or layer of fat around it so that they get absorbed very well. So that keeps the glutathione from being degraded by the digestive tract and lets it absorb a lot better. So liposomal, as opposed to other types of glutathione, are typically absorbed a lot better and much more bioavailable, so you get more in the body of what you're taking, and a lot of times they're a little more expensive than the other types. So when you look at that and you kind of wonder why liposomal is more expensive, that's why it's got a phospholipid bilayer around it to help with its absorption and decrease its breakdown. So things that decrease our natural glutathione, stress, I mentioned earlier, obviously, and then poor diet. So eating a diet that's rich in processed foods, a lot of preservatives, that can actually lower glutathione levels. Pollution or being exposed to toxins in the environment, molds, mercury, lead, heavy metals, things like that are all around us. I mean, you touch something metal, you can actually get some of that absorbed. It's very small amounts, but it doesn't take a lot of these heavy metals to cause trouble. So toxins, pollutants, poor diet can lower glutathione. And then medications, sometimes prescription medications can lower it, affect its level. Injury or trauma, so a significant trauma, being sick, so being in the hospital with pneumonia or having COVID and being sick for a few days, things like that can lower our glutathione levels. Radiation from the environment, so sun radiation, getting x-rays and CAT scans, they're safe, but all this adds up together. So I'm certainly not saying don't get x-rays or CAT scans or anything, but every time we get a little extra radiation just from the sun, sunburns, things like that, it all adds up over time. And simply aging, just as we get older, our glutathione levels decline. And studies have shown that healthy people that live a long life have higher glutathione levels. So it's certainly not a direct correlation, so having a higher glutathione level does not make you live longer. It's just an association that they found. People who tend to live longer have higher glutathione levels, so why not consider glutathione as a supportive measure in your supplements. So some ways to increase glutathione: obviously you can take glutathione supplements as we mentioned, but you can get it naturally in foods. So all your cruciferous vegetables, broccoli, cauliflower, things like that can help. Eat a lot of fresh vegetables. Whey protein can help. It's made from amino acids, and whey protein has those amino acids in it, so whey protein can help. You don't want to overdo it. Too much protein is not good for you, but certainly the right amount, a balanced diet is good. Exercise can help raise glutathione levels, and exercise helps a lot of other areas of our health as well. And then you can take things that support glutathione. So like I mentioned earlier, vitamin E and vitamin C are some. And then there's other things you can take. N-acetylcysteine can help, and alpha lipoic acid. I'll probably do a video on alpha lipoic acid later. If it's up, I'll link it to this video, but alpha lipoic acid, really good for nerve health. And then also B vitamins are good and supportive of glutathione. Selenium, another good supportive mineral. And then milk thistle actually can help too. It's been shown to support glutathione. And just a little bit off topic on glutathione, but when functional medicine physicians order testing for mold exposure and things like that, we can do a simple urine test to check for mold exposure, some mold exposures in the body. And what we'll have you do after that first test is take glutathione for a week and then do the test again and see how much higher the levels were, because glutathione will help detox those molds out of your body. So it can actually help detoxify the body of molds and other things. So it's good to support that and your immune system. It can actually help support your immune function, so to keep you healthy and better able to fight off viruses and bacteria, things like that we get exposed to, as well as toxins in the environment. It's something that you might want to look into as a supplement to help, and it's a good antioxidant. A few side effects, usually very well tolerated, but as always, discuss any supplement with your healthcare provider before starting it. And I hope this helped, and look forward to seeing you in the next one.